Overworked, undervalued and lacking in resources, nurses gathered outside this Brooklyn hospital are demanding action.
In order to stop the bleeding, they need to hire more nurses, qualified nurses, hire more nurses.
Russell Pinsker is an intensive care unit nurse at Maimonides Medical Centre. He says understaffing has left healthcare workers physically, mentally and emotionally stretched.
I'm afraid sometimes to walk into my patients' rooms because I'm afraid what I'm going to see, because I've been away from them for so long because we are so short-staffed. Patients stay dirty longer, family members come by, they have nobody to speak to.
Every patient is a VIP!
A Maimonides spokesperson says the hospital has hired more than 140 nurses over the past 5 months. But these demonstrators say that fails to cover a staffing shortfall that predates the COVID-19 pandemic. The message from those here is clear: to hire more nurses. The union National Nurses United say there's no shortage of workers, but a lack of safe and healthy workplaces. Healthcare experts say the pandemic has exacerbated staffing issues. The Bureau of Labour Statistics predict 500,000 nurses will quit this year, leaving US hospitals potentially short more than 1 million nurses.
It's a manufactured crisis that they have created, and they have made working conditions terrible and unbearable that nurses have chosen to leave the profession.
To offset staff shortages, healthcare systems across the US are increasingly leaning on so-called travel nurses, outside nurses who fill in and assist where needed. This surging demand has led to wages for some of these workers to roughly double. The trend has fueled concerns that hiring full-time staff may become harder for hospitals.
Temp staffing agencies means privatization of nursing workforce is happening. So private versus public. So it's going to draw even further wedge between the haves and have-nots, and in terms of access to healthcare.
Experts warn that the supply of new nurses will struggle to keep up with demand. The average age of a nurse in the US is around 50, prompting fears that the industry will see large numbers of retirements in the coming years. The National Guard has been deployed in some states to cover staffing shortages. Some warn this is only a band-aid solution, and until a more permanent fix is found, the standard of care for patients could suffer. William Denselow, CGTN, New York.